Um, Hi everyone. We're back for another episode. Don't know the exact sequence of episodes, but I presume this is going to be another one, as opposed to the first. We shall see. Anyways, my name is Julia Cruiser, and I'm a third year medical student at Geisinger Commonwealth School of Medicine. Um, Welcome to the AIAMC Medical Student Podcast. Um, with this podcast, we're going to be talking about medical students and the adversities they've overcome in pursuit of pursuing, in pursuit of medicine and them working to become future medical providers. I am excited today to talk with Katherine Narvaez Mena, a third year medical student at SUNY Upstate Medical University. I'm really excited to talk with you today, and thank you so much for being here.
No, thank you for giving me the opportunity to kind of share my story, talk a little bit about the challenges that undocumented students face when pursuing a medical education, and then just a little bit about the struggles that undocumented communities face when accessing healthcare.
Yeah, and well, thank you. You speaking today, I think really it is very brave and very powerful. So I'm definitely excited to hear your perspective. Kind of just starting off pretty broad, just tell me about yourself, whatever you feel that entails, and tell me about how you first got interested in medicine.
Yeah, so I was originally born in Guatemala, migrated to the United States when I was 6 years old. And my mother decided to settle in Atlanta, Georgia, a heavily immigrant, undocumented community. So growing up, I didn't really understand what it meant to be undocumented. To me, because everybody was undocumented, I just thought it was something normal. And it didn't dawn on me until I went to college when I started realizing what that meant, or when I was trying to go to college and I was like rejected from every public institution in Georgia because I didn't have a social security. I had a admissions counselor actually tell me that I should go to community college because that's where illegal people like me went. So from the very beginning, experienced a lot of hurdles, a lot of challenges. But one of the main reasons why I got so interested in medicine was just living in that community myself. It wasn't until much later that I started understanding how the social determinants of health can impact somebody's health outcomes. But I grew up, my mom telling me you can't open the door to anybody. I saw families being separated, whether that was immigration and customs enforcement showing up to people's jobs, kind of like what's happening now. We've always kind of experienced these type of things. It's just now it's a little bit more magnified. But immigration, like waiting outside of our apartment complex, like literally detaining people as they came home from work, immigration rates consistently, people being scared to access healthcare resources, or even just calling the police if there was a crime that was done to them, and a lot of these fear tactics and stuff like that. And then eventually, I started working at a community health center where I would see, nobody that came to work in my community spoke Spanish or was attuned with the realities that my community faced. And so seeing kids coming, like showing up when their third-degree burn was already infected, or people whose diabetes was so out of control that it was like an emergency and they had to be sent to the hospital, like all of these things that are very much very preventable, if people just kind of had one, somebody that looked like them; two, somebody that understood; and three, someone that could speak like the same language and can bridge that cultural barrier. A lot of the times the physicians couldn't do that, even though they were trying their best to provide optimal care. There's still that language and cultural barrier that really allowed them to truly empathize with their patient. And so for me, I first went to get my MPH because I got a little bit more attracted to that side. And then when I started realizing MPH or public health and medicine go hand in hand, policy go hand in hand, that's when I decided that, you know what, I think I'm going to have to go be a doctor.
Well, that's amazing to hear. Just using that adversity and like turning it into something so great and so noble. I guess one thing I wanted to ask about, what was it like, that constant fear, looming? I just imagine, like that feeling of like walking on eggshells, like, oh, what if there's someone from ICE today? And like I just feel like having that constant fear, like what's it like living with that?
You know, I think that's why I have anxiety now.
Mm.
Because it is something that, you don't know when you're gonna get a call from, your mom or your dad or something. And like my family has already experienced like deportation proceedings, my family, my community. And those places are very inhumane. And because you are technically not a US citizen, yet you go through basically the detention centers mimic the criminal justice system, except you don't have rights because you're not a US citizen, even though you should be protected by the Constitution and all of these things. But very inhumane conditions. I serve on the board of a nonprofit, El Refugio, who works a lot with detention centers. And I was an advocate for a lot of the people that were detained there. And there were people sleeping next to the toilet, sometimes not getting fed on time. I mean, just very inhumane conditions. And so for me, like just having that constant fear that like my family and my community are constantly at risk of being detained and deported and having to go through this system. It's very scary and very like nerve-wracking. But I feel like I have always grown up with like this fear. And it's a fear of family separation. My mom is old and she's no longer able to, like her health is not as optimal as we would want it to be. And so I worry that if she, gets detained and goes through like deportation proceedings, that, it's going to impact her health. And so it is very scary to like navigate this world, because I think about it. And, whether I was in college or grad school or even now in medical school, like I was recently in my surgery rotation and I had to tell my attending, hey, I have to keep my phone on me, because just days like before, ICE showed up on the same road that my family lives in, right? Because my community is an extremely like large undocumented community, so we already knew that they were going to be targeted. My dad called me on Sunday and was like, ICE showed up to their church and they got saved because they got there early. And so, they were picking up people as they were walking into church. And as you know, right now, this administration has said that like these sanctuary places, the safe places, were no longer like safe in a sense, because now immigration or ICE can show up to these places, whether it's churches, schools, hospitals, to detain people, which is very which is deterring a lot of people from accessing those resources, or even partaking in like their faith, and stuff like that. But I don't think there's like a lot of like emphasis on these things, because healthcare, I'm a firm believer that healthcare is a human right, regardless whether you're undocumented or not. Pursuing your education, or even just like wanting to worship in a safe place. But a lot of those things are being denied to a lot of immigrant communities right now.
No, I'm really sorry to hear that. And that is something that I have to say, like, I think that's absolutely something I take for granted, that this constant threat, I can kind of just go to the doctors or go to the public library or go wherever and just live my life. And that, like, I feel like isn't even something that I'll admit I even like think about. So I feel like that's very sobering. It's just like, that being a constant fear when you're living your life must be incredibly anxiety inducing.
Yeah, no, yeah, it's very And even in a sense, like I still feel like some sort of privilege, like to be here and be able to call attention to a lot of these issues that sometimes people never hear about, like even my peers not really understanding what it's like to grow up undocumented in America, living in the shadows, kind of not ruffling any feathers, not calling attention to yourself. And I just feel like I'm privileged in the sense that my parents never had the opportunity to advocate for themselves or advocate for their communities, but here I am in a position where I can call attention to these things and I can use my voice to kind of like advocate and kind of push the needle forward and just, I always a lot of the times there's just so much misconception that comes with with like immigrant communities, and I've been very vocal about social justice. I think that immigrant rights is like social justice, and so been very vocal and like receiving, even seeing messages from physicians, from my peers who don't believe that I have the right to be here, that I don't have the right to study medicine, even though I have very pure intentions as to why I wanted to pursue medicine in the first place. And it's very disheartening, but at the same time, I have a lot of people that understand that, like I do belong in these spaces and my voice is very much appreciated and I'm helping change minds and perspectives, which is what's important. A lot of the times we feel that we don't have any power, but sometimes just enlightening somebody, changing the perspective can just help us move forward in a more progressive way.
Yeah, yeah, no, it's truly, I think just hearing the perspective, um, I feel like you don't really understand, I mean, I couldn't begin to understand it, but I feel like the only reason I can have some appreciation for like the constant anxiety is hearing your perspective. So really, really thank you so much for that. Um I wanted to ask, you said you got your MPH, you were interested in policy, and that made you interested in medicine. Could you speak a little bit more to that, like how you started in with your MPH and how that helped you transition to wanting to pursue medicine?
Yeah, no. When I graduated college, I went back to Georgia. So I couldn't go to school in Georgia because they don't allow undocumented students to even apply. So I had to go to school in Virginia, moved back to Georgia, and I started working for the Georgia Department of Behavioral Health and Developmental Disabilities, um, managing a grant for them. And so I was working a lot with immigrant or refugee communities, and a lot of the issues that I saw that weren't that was very like, it was an issue and a problem in like American communities, for example, was not a problem in my community. Like, for example, the opioid pandemic, right? Like a lot of my community doesn't have access to healthcare system, so they don't have an opioid issue, but they do have other substance abuse issues that we needed to be targeting. And so it was like, I think that I just started realizing how I needed to just gain a little bit more experience in being able to like understand the social determinants of health, understand how to do planning in a public health program and be able to implement a public health program. So I decided to get my MPH, and it so happens that I got my MPH MBA because I was accepted to Hopkins. I became a summer fellow for them, and so I was able to get my MPH MBA focusing on policy and like healthcare management. Um, and it was then that I started doing research with detention centers and stuff like that. And I presented my work to various members of Congress. I did a lot of research and writing memos, public comments. And then I realized that when I would show up to these meetings, like even though I was doing all the work, even though I was putting in all the effort, my opinion was never asked. All they cared about was my story. And I was like, I'm more than my story. I'm more than just somebody who migrated to the United States who happens to be affected by this issue, but I also bring a lot of things into this, right? And so like I started seeing the humane treatment of immigrants and how even physicians and nurses, or the lack of healthcare in detention centers, and then coupled that to working in my immigrant community at the healthcare center, and just seeing a lot of these things. I think that a lot of that compounded itself, and I was like, okay, like I think that the best thing for me to do is to go to medicine to become a better advocate. And I can work in the intersection of policy, public health, and medicine to truly impact policy that can like improve population health in a sense.
Yeah. Yeah, no, that's amazing. Especially you said, you're more than your story. It's like, while your story is very powerful, you obviously have a lot to contribute in terms of um helping future patients, and um you have something to contribute in terms of imparting medical knowledge and helping individuals in the future. So I think that's amazing that, while your story has given you a lot of inspiration and motivation, you're still obviously incredibly capable and, have something to contribute beyond your story, if that makes sense.
Yeah, no, and it became very much apparent, as I was granted, like I had a fellowship, like the first year of my medical school, like that summer before going to my second year, and I happened to go back to Georgia and work at Grady, which is literally like 10 minutes from my high school. And yet, Emory Grady, and yet people can't access that healthcare system as much because of like the political climate or what have you. But there was this one patient, I remember my very first patient. She had stage 4 breast cancer, didn't speak any English, and I was working on the oncology ward. I was shadowing a physician in the oncology ward. And as soon as I walk in, she's like, Doctora. And I'm like, no, not quite there yet. Like, I still need a couple of years. But I was the only person in the entire oncology ward, like in that floor, that could actually speak to her directly. I came to find out she was undocumented. She her work didn't really allow her. I mean, she was the sole provider for her family. She had a couple of kids here, but then she also had a kid back home. And so, I realized then, like, being smart, yes, it's important. You want to pass all your exams and stuff like that. But I remember when she left, she asked to give me a hug. And she basically said, thank you for being here with me, because they gave her the diagnosis when I was there. And like, I was holding her hand. And, when the physician left, I stayed behind and I talked to her. And, we talked about everything. Like at that moment, like Peso Pluma, which is a Mexican, like artist, was like up and coming, and we talked about like tamales, and she just told me about how she missed her kids and her family and back home. And being able to relate to that with her. And like, she grew up on Before Highway as well. She literally, like, the physician told me, asked her, oh, how long do you have to travel to come to chemo? She's like, oh, like 15 minutes. I live on Buford Highway. And at that moment, like exactly at that moment, I realized that I had a connection with her. And for her, to thank me for being there, one of the hardest moments in her life, was truly that I will always carry with me. And I think that, every time I feel like I don't want to keep going, because medicine in general is hard, but then also having to navigate the political climate, advocate for your community, all of these things, and navigate spaces where people look down on you because they don't believe that you belong here. I am reminded of that moment, that I was beyond, understanding and explaining to her what's happening, that I was able to be there for her, on a very like intimate level, that I understood what she was going through as an undocumented person. Not, like, not the disease itself, but like that I was able to connect with her on so many other levels and be there for her was very rewarding for me. And it poured onto me to make sure that that's one of the reasons why I decided to pursue medicine, because I know that there's a need, and I don't represent an entire population of undocumented immigrants, because we all walks of life from all over the world. But if I can have a patient that can identify themselves and can feel supported, and understood, I feel like, I am doing what I am intended to do as a physician, beyond just providing healthcare.
Yeah. Well, That's fantastic. Yeah, I think there are moments where it's just like, I don't want to say it all makes sense, but it just feels like this is why I'm doing what I'm doing. And it sounds like that moment for you was like that, this being able to have this emotional connection with this patient based on our shared experiences. It was kind of that moment of this is why I'm doing what I'm doing.
Yeah. And it was just for me, it was just a reminder why I started in the first place is to help people like that. And um to realize that, like, for her, she went to get checked when it was already too late. And a lot of those things, especially breast cancer, is something that, if you get mammograms and and it's a lot of and I think there's just so much fear. And as undocumented immigrants, sometimes you don't have like the luxury to just have one job. A lot of the times you're working multiple jobs, getting paid sometimes under the table because you don't have a social security, you don't have a tax ID, you don't have any of these things. So having to kind of overwork yourself, you kind of put your health in the back burner. And it's very unfortunate because I've seen it happen so many times. And that's why I worry, now that immigration can go into hospitals, because the hospital, like an ER, sometimes serves as a primary care for a lot of undocumented communities. And so I fear that a lot of them will resort to not showing up when there's an emergency because they're scared that immigration might show up.
No, um it's tough times, I mean, that's the understatement of the millennia. But I do think, you speaking your story and having the courage and the bravery to share your experience. I think that's like how we navigate scenarios like this. Um wow, I don't know what else to say. That's very, very intense. It's just like something admittedly I feel like I didn't even begin to appreciate. And hearing your story is very enriching and I feel like very mind-opening. So thank you so much for that.
Yeah, no, I appreciate you giving me this platform to kind of discuss a little bit about what's happening and just like my story. And I'm a firm believer that, I'm just like one person, but if we can get people to kind of understand what's happening and advocate, like advocacy from a lot of people, it's very important to try to move the needle forward. There's 11 million plus undocumented people in the US, but DACA recipients or undocumented folks make less than 0.01% of the people in medical school. Or, I think the last time I checked, it was like 250 DACA recipients that were, or a little bit over 250 DACA recipients that were in medical school or practicing as a physician. But there's a lot of hurdles and barriers that I've had to overcome to even just get here, and whether I'm going to be able to practice medicine or not is up for debate. Whether they rescind the program, whether I'm going to have a work permit to even apply for ERAS. Like I'm supposed to submit my application this September, and I'm still unsure if I'm going to be able to do that. So there's like a lot of uncertainty. So for me, it's kind of just making sure that I'm putting in the work, but also understanding that despite putting in the work, it still might not happen for me. And so needing a lot of people to like advocate for dreamers and DACA recipients. And um, we grew up here. We are part of America has
Mhm.
invested so heavily in us. And it's not like you can take me out of the system and then put somebody else in. Like, you've already invested so much time and so much energy, and I've sacrificed a lot to be here. And so, just making sure that we have people that champion our cause as well. So
Yeah. All righty. Well, thank you so much again. This is Katherine Narvaez Mena. And it really was a privilege to speak with you today. So thank you so
thank you, Julia.
much.